Hello, everyone, and welcome to CCA's Medical Minute, sponsored by Kroger Health. It's our 47th episode, and today we're talking about Ovarian Cancer Awareness Month, September. And we have a very special guest with us today. We're going to be talking with Shelley Hastings-Toms. How are you, Shelly?
I'm good. Thank you so much for having me.
It's good to have you here. We also have our trusted friend and our Precision Oncology Director, Andy Guinigundo. Andy, nice to have you as well.
Great to be here. Great to be here.
Well, you know what? We're going to dive right on into this because it's a very important topic, and it's ovarian cancer. And before we meet and talk with Shelly a little bit more, Andy, tell us, why is it that ovarian cancer tends to be diagnosed at the latest stage? And is there any type of screening or genetic testing that can be done to detect ovarian cancer?
Yeah, unfortunately, the ovaries are in the belly. You know, I always tell patients to consider, what you eat for Thanksgiving dinner, and it's how big that is. And that all goes in your belly, and maybe you feel a little bit uncomfortable at Thanksgiving dinner, but you don't go to the doctor because of it. And so there's a lot of room for things to move around in there, and there's a lot of space for that cancer to grow, and you can have a softball size tumor before you know it. But, in terms of screening, we hear about women getting their yearly mammogram starting at age 40 with a normal risk. We talk about men getting PSAs, and all of us supposed to be getting colonoscopies. But unfortunately, there is no routine screening for ovarian cancer.
What about genetic testing?
Well, genetic testing is one way to screen for risk for ovarian cancer. So, for example, we hear about BRCA testing in relation to breast cancer, and same as for ovarian cancer. Interestingly enough, the other major hereditary cancer syndrome is called Lynch syndrome. It's really the colon cancer syndrome, but it's part of that too. Okay. So when you talk about a risk of, a lifetime risk, less than 1% for women.
Wow.
But with these genes, anywhere from 20 to 50 or 60% on up for their lifetime.
That's what
that's astronomical.
Yes, and we are so excited because we have a miracle sitting here with us today. Not only is Shelley Hastings-Toms a nurse, but she's also an ovarian cancer survivor. She's living with ovarian cancer at this point, and she's also an advocate with the Ovarian Cancer Alliance of Greater Cincinnati. So, Shelley, you are a walking miracle. You're here. You're a survivor. Tell us a little bit about you and your story.
Well, I am married. I have 2 kids, and also work as a nurse at Tri-Health in the recovery room, outpatient services. I ended up being diagnosed late 2015, went for my yearly exam, and the doctor felt something in my right upper quadrant. We went and got an ultrasound, had blood work drawn, and ended up finding a mass. At that point, CAT scans, lots of different testing. And in November of 2015, I found myself on an OR table having surgery. My tumor was about 10 pounds.
Wow.
It was very large, and it ruptured on the table. Therefore, I have microscopic cancer throughout my pelvis. Long story short, went through chemo, lost my hair, and then was cancer-free for about 28 months, and then had a recurrence. Went through chemo again, and now I'm on a medication called Lynparza. Lynparza helps block growth of any new cancer cells, and I have about 5 spots in my abdomen that I am living with, but they are just sort of hanging out and not doing anything and preventing new growth.
Well, Andy, you're talking about the genetic part of this. Is there any way through the microscopic cells that are inside of her that, that's a way to further, test genetically to see the probabilities of any more cancer occurring?
Yeah, so a couple of genetic angles here. So really when we check for hereditary genetics, we're really testing just a random sample of cells. So we're really saying, did your mom give you a gene that's mutated that can increase your risk? Did your dad give this to you? So it's not just mom who, because we're talking about a hereditary, because it's a woman, it's a female disease. This could easily come from dad. But, in terms of other genetic pieces that we look at, there's technology out there that can look for this minimal disease. So if people stay on therapy a long time, we can see whether or not it's what we call molecularly trackable, and so those are different genetic angles that we look at.
So once again, there is no direct screening, is what we know, but there are symptoms. And Shelly, did you experience any before you went and had the diagnosis? Did you know that something was not quite right?
Well, that's the problem with ovarian cancer. The signs and symptoms are very subtle. We use the BEAT acronym. B is bloating. I did not notice any new bloating, but we as women have been bloating monthly since we were teenagers. So when we do bloat, we don't necessarily think much about it. E is eating difficulties, feeling full quickly. I myself am a grab and go kind of girl. We all are very busy in our lives, and I think that we do tend to grab a little something here, grab a little something there, and then when we actually sit down for a meal and eat, and your belly hurts, you kind of go, oh, I must have eaten
not
too
a big
fast.
deal, right?
Yeah. A is abdominal pain, pelvic pain. I did not have that. I had lower back pain. What nurse doesn't? So I never thought anything about that. T is trouble with urination, urgency or frequency. I did have that. I actually had said something to my GYN a year prior about it, and he was told, not a problem, don't worry about it.
Yeah, some women might think it's a UTI or something like that.
Yes. And I think that with us seeing a lot of incontinence protection commercials, I worry about, will our youth grow up and think that this is normal? And 9 times out of 10, it is going to be age related, but for that one person, it needs to be checked. And you need to have those conversations with your doctor about that BEAT acronym: bloating, eating difficulties, abdominal pain, pelvic pain, trouble with urination. And ask for testing. Testing can be a transvaginal ultrasound. Also, there is a blood test called a CA-125. It is not a true tumor marker like the PSA is. It just simply is the best that we have right now.
And Andy and I, we talked about that before you arrived. And what do you know about that particular test, Andy?
Yeah, so CA-125, we do use it to track tumors, and it's similar to PSA, but unfortunately, I always tell patients it's not as good as a PSA. So it's not a good screening tool. There's just too many false positives. So we'd be ultrasounding and CAT scanning everyone if you had this elevated CA-125. Now, I talked about the genetics. So if someone might be higher at risk, or if there's a family history, or there's something that says this person might be higher at risk, that might be someone where you might say, well, normally we wouldn't check this test, but on you today, we're going to.
And I want to mention some of the risk factors. Family history, of course, we mentioned that a woman whose mother or sister has had ovarian cancer, women who have had breast cancer like myself, uterus, colon, or rectum are at higher risk, and someone like myself that has never had children. That I found that in terms of studying for today, that wow, if you have not had children, you put yourself at a higher risk for ovarian cancer, so you need to be sure that you're keeping vigilant. What do you want, Shelly, women to know most? Because one of the things that I saw when I was putting out feelers to get someone to talk to us is a lot of women were saying, no one ever talks about ovarian cancer. It's always about the breast and this and that. What do you want women to know most this Awareness Month?
Signs and symptoms, and don't be afraid to talk about it. Have those conversations with your doctor, and if you feel like they're not listening, or you feel that you're not being understood, keep talking. Advocate for yourself. It is so important. 85% of ovarian cancer patients are diagnosed in advanced stages. Very few are diagnosed in the early stages, and that's what we need to change.
We have to change that, and we have to save more lives. Now, one of the ways that your organization, Ovarian Cancer Alliance of Greater Cincy, is trying to get that awareness out, and we have about a minute or so to go, is that you all have a teal power walk, and I want to compliment you for that teal that you're wearing to show support for that. When
Teal
is
is
it?
our color.
Yeah.
The walk is September 17th at Summit Park in Blue Ash, Ohio.
Okay, and who can participate?
Anyone can participate. Just go to our website, tealpower.org, sign up. My team is Shelley's Walking Warriors. Anyone is able to walk on my team. The more, the merrier.
Thank you so much for coming and shedding light about ovarian cancer. Shelley, it's a pleasure and to have you here. And we're going to talk to you some more because I found that you have some even more fascinating stories around your diagnosis. Andy Guinigundo, we appreciate you being here and dropping some stats on things about precision oncology. We thank you all for being here. You can share this podcast, of course, with your family and friends. It helps us to help other people that are going through cancer diagnosis. As always, join us every Wednesday for our CCA Medical Minute. Thanks and have a great day.